Let us go to the differential diagnosis of Western NCM. The topic is common cold and influenza. So first, let's look at the Western differentiation of common cold and influenza. Number one is common cold, an upper respiratory infection caused by a cold virus. The signs and symptoms that usually begin 2 to 3 days after infection may include runny nose, nasal congestion, sneezing, sore throat, postnasal drip, cough, and headache. The causes are commonly by rhinoviruses and coronaviruses. Cold spread by airborne droplets when a person coughs or sneezes, or by hand contact. The risk factors are for children to tend to have more colds than adults. Adults have built up immunity against some viruses. And number two, influenza, an upper respiratory infection caused by a flu virus. The signs and symptoms is sudden onset of fever, sweating and feeling ill, general muscle aches and pains, tiredness, malaise, dry chesty cough, sneezing, running or blocked nose, and difficulty sleeping. The causes of influenza is the influenza virus family contains 3 main types, A, B, and C. Influenza viruses are known to mutate over time. Influenza A occurs more frequently and is more serious. It regularly giving rise to pandemics. And the risk factors is flu can develop into a high fever, acute bronchitis, encephalitis, and pneumonia. Risk of serious illnesses is higher in the elderly, specifically over 65, babies and infants, and people with chronic illnesses. For Chinese differentiation, diagnostic questioning would be according to number one, the 4 levels or aspects. The number one is the defensive Qi or Wei Qi aspect, which is wind heat. Then there's Qi aspect, external heat, strong body with organ function impaired but not badly. Heat either in the chest and diaphragm, stomach channel, or Shaoyang channel. Then next is nutritive Qi or construction or Yin aspect. The heart function is impaired, heat leading to burning of Yin. And then there's blood aspect, where there's exacerbation of nutritive level, with heat causing bleeding like encephalitis, meningitis, and acute leukemia. And number two is the 6 divisions. There's Taiyang, which is the bladder and small intestine, the Yangming, the stomach and intestines, where there's strong pathogen, strong body, and heat. The channel stage and organs are not affected. In the organ stage, where there is desiccating heat in the intestine, constipation, and delirium. And then there's Shaoyang, the gallbladder, and Sanjiao, which is mid-stage disease, half exterior, half interior. And number 3, symptoms of phlegm. So we look at the location, if it's in the nose, throat, or if it's vomited. We also look at the cough, if it's dry, productive, loose, weak, or forceful. And of course, the color and nature of phlegm, if it is white, yellow, clear, blood-tinged, watery, thick, or sticky. Then there's the Zhangfu organs. The first is defensive Qi aspect, where there's wind cold invading the lung, wind heat invading the lung, wind dryness invading the lung. Or the Qi aspect, there's lung heat, phlegm heat obstructing the lung, stomach heat or fire, gallbladder heat, and damp heat in the stomach and spleen. There's nutritive Qi aspect, where there's heat in the pericardium, and blood aspect is heat in the blood, and heat leading to stirring of internal wind, yin deficiency with lodged evil. Thank you so much for your attention.